Good morning, everyone. My name is Minzhi. Currently, I'm in the computer science department and working on the Spatial-Temporal database. Today, what I'm going to talk about is the public health informatics and the Spatial-Temporal database. I will first talk about population and environment and the GIS system, and I talk about the spatial database, the progress to date in the health application area, and their limitations, and the computer science opportunities, and the spatial-temporal database, their issues, and possible solutions. There's an emerging field of spatial epidemiology, which deals with distribution and control of diseases in a population. We could collect the data such as poverty level, the spatial network, population change, land use, and community facilities, climate changes, all those data. And with all those data on hand, we could able to study the space distribution of health-related risk factors based on the data such as areas of poverty, physician shortage areas, toxic release inventory, and we are able to do the pandemic predictions, population growth analysis, and etc. We are also able to analyze the geography of diseases, such as distribution of causative agents, the geographical distribution of population at risk, all those stuff. With those data on hand and the goals we want to achieve, we establish a geographic information system. This is a powerful information management system that supports querying, updating, which is based on the spatial database. Now I talk about the spatial database, which is the underlying of the GIS system. In the spatial database, we store the location of an object in 2- or 3-dimensional space, like any kind of traffic maps. We may also store some other properties of the object, such as the time extent of the data. Such kind of spatial database could support 3 types of queries. The first one is the nearest neighbor query. For example, we could find the toxic waste site, which is nearest to this groundwater well. We could support a query such as, given the query point, find the distance to the nearest emergency center with the shortest waiting time. The window query, for example, find all of the patients located in the zip code boundary. Find all the toxic waste site within 20 miles of a village, and could also support the spatial join query. Here I give, to support those types of query, we need spatial indexing structure. There are various of indexing structure have been proposed. For example, the cell method, which is to divide the whole space into subspace. The most popular one is the R tree. It's like a B tree. Tree is a balanced one. Data stored at leaf node. The internal node is the smallest rectangle that spatially contains the rectangles of the child nodes. For example, with this R tree, we could support the query like find the residential district which is nearest to the toxic waste site Q. Here, we don't need to calculate all the distance between the Q and the residential district. We apply the index on that, and we keep a priority queue and keep a minimum distance. Minimum distance is the query, the leaf node and the query. And in here, if the internal node, the distance between the internal node and query is larger than the minimum distance, then we don't have to calculate their child nodes to the query point. This largely speeds the query processing. Here, we find the minimum distance in the internal node of R7. Then all the other internal nodes, we don't have to calculate their child node's distance. We could also solve the spatial join queries like this. Here, I give some applications that use the spatial database to curate public health information. Here, this one is we provide a window here, and then we will get the result of what kind of HIV service we provided in this window region. Here's some a NAROM project that's done in Thailand over the last 20 years. They established a GIS system to support the research study. Here is the example that to surveillance the risk factor, they based on the spatial database, they could query the areas of poverty, the rural population, the physician shortage areas, and use the maps to illustrating health risks at national, state, and local levels. In this project, we could query the cancer mortality and use maps to show the results. There's many more applications in this area. However, there are limitations there. The time factor is a fundamental property in health informatics, but currently there's no applications to predict the health information in near future through the spatial database. The prediction is done by simulation. However, it's very expensive and not flexible. We have computer science opportunities there. We could support new queries for predicting the future. For example, given the current population increasing trend, where is the region with highest population density in the next 10 years? We could, of course, predicting far into the future will be inaccurate, but we can predict events in the nearest future. The example queries we may able to support is like this: nearest neighbor query. Given the ambulance current location and velocity, what will be the nearest emergency center with shortest waiting time in next hour? The window query, for example, given the expanding pollution speed of the toxic release spots, what will be the affected residential districts in the next 2 years within this query region? We could use the Spatio-Temporal database to support that kind of queries. We could add the velocity parameters in data model. Objects' movements or some properties changing rates are expressed by mathematical model. For example, in the database, we store the initial location, velocity, and the reference time of an object. Here we store the x, v, and time reference. And we are able to calculate the object's current location using this leaf function, the linear function. To support that kind of query, various indexing structures have been proposed. Here is an example that the time parameters, the R tree, we call it TPR tree. This is based on R tree I introduced before. We not only store the space extent, but also store the velocity extent for each node. Here I give an example how to use the TPR tree to solve the nearest neighbor query. For example, given the expanding pollution speed of a toxic release spot, what will be the nearest affected residential district? Here how to solve this query, we find the first leaf node that intersect with the toxic release routine. Here the toxic is keep on expanding. The intersect one is the R17. We don't have to calculate all those leaf nodes. We just starting from the root to the leaf node. Here we found the R7 intersect with the query routine. Then we don't have to check all those leaf nodes. The rule to prune unnecessary search like that: if the parent node does not intersect with the query routine, then the children will not intersect with the query routine. We don't need to calculate those children nodes. We could also calculate, suppose a query like, given the expanding pollution speed of the toxic release spot, what will be the next nearest residential district? We could first, here we see that the toxic routine is keep on expanding. We first find the current nearest residential district, and we could keep on finding its nearest one. But the issues to use the spatial-temporal database to support those kind of queries is like, we need accurate mathematical model to predict the future events. However, it's hard to establish accurate mathematical model in public health information field. As we can see that those expanding routine maybe keep on changing. The second one is current spatial-temporal database have not matured yet. The biggest problem is the database maintenance. For example, this TPR tree, at initial time we established this indexing, but as time goes by, these internal nodes keep on expanding as the children nodes keep on moving inside these internal nodes. And finally, those internal nodes are overlapped with each other, and those indexing structure is no longer useful to support those queries. The possible solution is that we could maintain high percentage of updating operation. That is, we keep on adjusting the mathematical model to improve predicting accuracy, and to adjust the indexing structure to support query efficiency. The experience currently have done that if we have maintained a 20% updating of the leaf nodes, then it's possible to maintain the high quality of the indexing structure. My conclusion is like that. The spatial database is deeply involved in the public health informatics, and it is possible to extend the spatial database to spatial-temporal database to predict the public health information in near future. Here's my reference. Any questions? Yes?
I have 2 questions. You mentioned the use of zip codes. Could you go back to the nearest neighbor slide, the nearest neighbor query slide?
Oops. This one?
This one.
Which one?
It's called nearest neighbor query. It had the diagram. Might actually be able to check this.
Before that?
I don't know what it is. Anyways, the question is, how is zip code data used? How is it broken down into different child?
In fact, each zip code data in there, we stored its location. For example, in this area, all the fill into this zip code, we store their location into the database. Yeah, the zip code, for example, the name is N2N something like that. And then we store their location, the boundary points into the database. And when we query like that, we establish the R-tree based on those locations, based on those boundary data.
The other question I had is when the example that you gave with an ambulance en route trying to find the closest hospital
Yes.
with the first waiting time, is that, in terms of the distance calculation, is that done as it crow flies? I mean, would it be also using postal code data, or would it take into account the actual route that would have to be taken by the ambulance?
Yeah, in this the query routine is the ambulance the routine. We could adjust that, and the ambulance routine we have a mathematical model. For example, it's a linear and it's a non-linear or linear whatever, and then just like this one, the ambulance routine is changing, maybe not linear, but we use the same method to query what's its nearest hospital.
So it's an approximation.
That's why I said that. It's hard to get the accurate mathematical model, but we could keep a high rate of updating operation and keep on adjusting that routine, and we will get a pretty accurate prediction. Yes?
With respect to your R-tree, when the regions merge and split, what do you do? Because from experience, these are the kind of things that affects the tree's runtime the most.
You mean how I establish the R-tree, right?
No, not how much established. How it's like if you have a residential area and it merges with another neighboring one. Do you do updates like that, or is it done automatically or manually?
When, for example, there are some data we need to update, there are some rules we follow. One is that we choose for example, 2 residential districts. We subdivide them that their overlapping area is minimum, and their distance is the maximum one, and other extra set of rules to apply. If this, for example, one residential district is keep on expanding, and finally there are some rules the baseline is broken, we may subdivide that residential district. In some that we keep on our indexing structure is optimized at all the time.
You've talked about public health here. Are you actually applying this in public health yourself in your own work?
No. Currently, I'm working on the Spatial-Temporal database. This work, that's for all the work I mentioned here. for the spatial-temporal database work, currently no application have done in that field. No public health information application have done in that using the spatial-temporal database.
Are you sure of that?
Yes. Spatial-temporal is a quite new one. Currently, all those research just started.
Well, clearly, there is an immense opportunity here for this technology, and I don't know if you're aware of it or not, but the province of Ontario is in the process of establishing a public health information system on which it's going to spend order of $100 million. And I don't know to what extent this type of technology has been considered, but it might be interesting to.
Yes. As I said, the artery, this indexing structure is a matured technology, but the spatial-temporal database is not quite mature. Those indexing structures, such as TPR tree and a lot of other trees, they have this kind of or that kind of problems. So I think that's why they don't use that.
Well, they may actually, very often in this field, they're simply not aware of the potential. So I don't think you should assume that. I think what would be interesting is to communicate with them about the work that's going on here, and then at least let them be aware of what the possibilities are. Second thing, I can't remember if I mentioned it the last time, but Don Callan has developed a system which does not use GIS, but uses a database view that's geographic. He developed his own technology. They do spatial queries with boundaries of they can draw in squares, circles, or arbitrary boundaries. And it might be interesting to import some of these ideas into that database. He has also proposed using that technology related to the public health information systems requirements in the province. So we really should discuss this and get your work known to him and to the people in public health. Any other comments or questions? If not, thank you for an excellent presentation.
Thanks for listening.